Well, hello everybody. This is Dr. Carmen Bryant, and this is Car Chronicles. How you guys doing? You ready? Let's do this. I've had a lot of people ask, and I know maybe some of you guys have the same question, is it possible that a narcissist can have more than one mental health disorder? Absolutely. Narcissistic personality disorder is just one disorder, but oftentimes you'll find out that they have PTSD, complex PTSD, depression, anxiety. They can have schizophrenia. They can have autism. They can have schizoaffective. They can have anxiety. A lot of them do. They have anxiety disorders, but let me just break this down for you real quick so you can understand something. So for many of you, like myself, I went to graduate school when they still had the Diagnostic Statistical Manual, or the DSM, of psychiatric disorder, the DSM-4. And the DSM-4, they had it broken down where we were still diagnosing off of multi-axial system, off the multi-axial system. Multi-axial system. This is something that is learned on the graduate level when you are learning how to do assessment, diagnosis, and treatment planning, or psychiatric assessments, or what you call psychological assessments. And there were categories. For example, Axis 1 was mental health and substance abuse disorders. Axis 2 was personality disorder and personality disorders, which is cluster A through C, or A through D, A through C, and mental retardation. Well, now it's not called mental retardation anymore. It used to be mild, moderate, and severe. Now it's called cognitive. With the new DSM-5, it's called cognitive or intellectual delays. And what we learned in school is that personality disorder, or that Axis 2, was something that was not curable. You couldn't treat it. In other words, most insurance companies will, pay for the services provided when you're providing services for the Axis 1, which is mental health or substance abuse disorders. But when you're dealing with the Axis 2, which is the personality disorder, those personality disorders, those disorders were not treatable. Those right there were more of quality of life type of situations, but those required long-term care, long-term insurance care, and most insurances were not going to pay for long-term care. So you had to focus on the Axis 1, even though a lot of therapists do work with those that have Axis 2, because they're also treating the Axis 1 at the same time. So it's a permanent personality disorder. It's permanent, is a part of your character. Now, Axis 3 consisted of general medical conditions. People had diabetes, if they had hypertension, high blood pressure, that's what that is. Anything else, any kind of medical issues that could look like a mental disorder. Go to number 2. Okay, this is Dr. Carmen Bryant. This is Narcissistic Personality Disorder and Other Mental Disorders, Part 2. All right, so the last one we went over, Axis 1, which is mental disorders and substance abuse. Now, keep in mind, this is from the old DSM-4. Axis 2, which is personality disorder and mental retardation. Axis 3, which was medical condition. Axis 4, which was psychosocial and environmental issues, such as housing, housing, medical care, things like that. Things that affect a person socially. And Axis 5 was the general assessment of overall functioning, used to be known as GAF. Global Assessment Functioning, something like that, which is now, they don't use that in DSM-5. And keep in mind now that the manual takes mental disorders and puts them in classes, meaning they classify them with similar symptoms and disorders that look similar, have similar symptoms, have similar clusters. At one time, you used to have mood disorders, which has changed to bipolar disorders or related disorders, or depressive disorders. You also have anxiety disorders, and a lot of those you'll find like post-traumatic stress, you'll find anxiety disorders and things like that. Now, you still have 3 classes of personality disorders. So I thought D, it's not D, it's A through C, which is the cluster A, which is the eccentric and odd disorders. Paranoid personality disorder, schizotypical personality disorder, schizoid personality disorder. Cluster B, erratic or dramatic, and you guys should know this. Borderline personality disorder, histrionic personality disorder, narcissistic personality disorder, and antisocial personality disorder. It fits the bill, doesn't it? Erratic and dramatic. Drama kings and queens. Cluster C, fearful and anxious, avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. Different than obsessive compulsive disorder. This is a personality disorder, part of a character. The Mayo Clinic indicated that a lot of people that do have a personality disorder usually has signs and symptoms of another personality disorder. So they usually have another personality disorder to go along with it. Now keep in mind, when you're dealing with like narcissistic personality disorder, a lot of you will pick out all the personality disorder within that cluster B. That's why in the world of psychology, those of us in the mental health field have to understand how each one of those personality disorders works. Now, there's a high percentage of people that do have borderline personality disorder that also have narcissistic personality disorder, and vice versa. A lot of people with narcissistic personality disorder also have borderline personality disorder. But if you look at the cluster, all the symptoms feed into each other. Go to part 3. Okay, I'm back. Dr. Carmen Bryant, and this is Narcissistic Personality Disorder and Mental Health Disorders, part 3. So we talked about the axis of the old DSM-4 and how they kind of put that together, where they don't have the axis anymore. It's kind of together when you do the assessment and diagnosis and treatment planning. And then we also talked about the cluster B personalities, the classes of diagnosis, the depressive mood disorders, which is changed to bipolar disorder, related disorders, or depression, anxiety disorders, which also entails or encompasses the post-traumatic stress, post-traumatic stress and post-traumatic stress disorder, anxiety disorder, general anxiety disorder, those type of things, depressive disorders, those type of things. Then also the personality disorder, the cluster A through C, and the difference. So now we're talking about the personality disorder. Personality disorders cannot be treated. 9 times out of 10, you're treating the mental health disorder, the anxiety related to it. And yes, narcissists can have other mental health disorders. A lot of you guys, sometimes you generalize because you've had an experience and that's your experience. Now, why are all of them the same? Because all of them have the same disorder. So you can find the traits and the symptomology of the cluster B personality disorders. A lot of people want to say they have all those disorders. No, they have clusters, meaning they're in that cluster, meaning that they have symptoms of all those. That's why they're called clusters. And that's why, you have to be trained enough to know what you're dealing with, because sometimes you may not be dealing, antisocial personality disorder, they have narcissistic personality disorders. They have it. A lot of people that work in the prison system, the forensic psychologists will let you know that those that have antisocial personality disorders, they also have narcissistic personality disorders. And so, but they all kind of bleed into each other. So you'll see traits of all these different clusters that create this particular personality disorder. A lot of times, some of them may not have the other disorders. They have one, and sometimes they have more than one personality disorder. Sometimes they have it outside of the cluster B, and they have maybe cluster A or cluster C. Because if you notice, narcissists are also very paranoid. Some of them more paranoid than others, where it becomes a disorder. But a lot of them do have other disorders. A lot of them do also have paraphilic disorders, in other words, they're perverts, they're paraphilic disorders, like pedophilia or fetishes and things like that. Some of them don't at all. Some of them have substance abuse problems. So each one of them that have this disorder may also have other disorders. So yes, a narcissist can have other disorders. They can have cognitive delays. They can have thought problems. Yes.